Welcome to the treatment group video for the diagnostic category of depressive and bipolar disorders. I will be presenting on the diagnosis of bipolar II. My name is Dr. Brianna Triano. My client's name is Jessica Scott, and she is 38 years old. There are two differential diagnoses, the first being bipolar I and the second being bipolar II. Bipolar I was ruled out because criterion A was not met. There were two primary diagnostic features, the first being people with this disorder cycle between depression and hypomania, and the second, when hypomanic, exhibit difficulty controlling impulses, expansive mood, and sometimes irritability. For Jessica's story, she is currently being referred for a psychological evaluation by her current psychotherapist. She is 38 years old and a part-time grad student who lives alone and currently supports herself by cleaning houses. Jessica is a very bright individual and has actually completed the coursework for a PhD in political science about 2 years ago, but she has not yet begun her dissertation. Jessica has also been treated for ongoing depression throughout her life. During her evaluation, Jessica mentions a very difficult upbringing. She explains that both of her parents worked. Even though they both worked, they still struggled financially in order to keep a roof over their head and food on the tables. She was also an only child and remembers feeling very lonely because she would oftentimes go home and be by herself. When her mom was home, she was often drunk because she would drink in excess in order to cope with the current challenges that they were experiencing during that time. During the times that her mom was drunk, she would often emotionally abuse Jessica, and she remembers thinking that her dad was a very weak man because he would never protect Jessica or stop the emotional abuse that was happening from her mom. At the age of 16, Jessica had a suicide attempt, and she was referred for psychiatric treatment for her ongoing depression, and since then she has seen therapists off and on, but recently her depression has deepened, but she has not yet sought out help for that depression. Jessica has been in a long-term relationship for about 2 years now, and she claims that she really loves him and she can see herself marrying him in the future. However, her boyfriend has shown a lack of interest in the relationship, and he has actually expressed to Jessica that he thinks that they might need to go their separate ways. Because of this current event in their relationship, Jessica's depressed mood has increased, and she describes being very depressed, and most of the time, in order to cope with her sad feelings, she does that by eating. And Jessica will often snack on like chips and cookies and kettle corn, or she'll make herself a peanut butter sandwich. Because of all the snacking that she's been doing to cope with her feelings, she has gained over 20 pounds in the last couple months. She also explains that she often wakes up in the middle of the night and is unable to go to sleep for hours at a time. And then the following day, after not being able to go to sleep, she'll often oversleep, and she'll end up sleeping for about 12 to 13 hours total. And although she gets all 12 to 13 hours of sleep, she still expresses that she's always tired and has no energy, or she has a lack of interest in life. For Jessica's academic history, she has been very inconsistent. She has a master's degree in psychology and was actually a counselor for a little while, but she found that it was too difficult and very sad to listen to her client's stories, so she started the PhD program in political science and completed the coursework, but interrupted this to train for a paramedic at the local community college. She never actually finished the program, and she still has not begun the dissertation that she stopped in order to become the paramedic. She has never worked a job for more than a year at a time, and currently she is cleaning houses, and she's been doing that for 9 months. Her romantic relationship that she's currently in is also her longest relationship. She has had multiple relationships, but they often end within a couple months because Jessica has a habit of being very demanding and confrontational. And although that Jessica is being seen for her depression, she is asked that if she has ever felt any emotional highs. And Jessica describes that she'll often cycle back between depression and feelings of being up and having an uplifted mood. During these periods where she is feeling up, she gets very little sleep, sometimes averaging 4 to 5 hours a night. She runs up huge telephone bills, and she's very talkative, and she feels as though her thoughts and her feelings are just racing. She gets a lot done during these times, but she also states that her friends are expressing a lot of concern about her because they think that she needs to slow down and stop taking so much on at one time. During these episodes, she gets a lot done, and she has never gotten into any actual trouble. And that is it for Jessica's story. For the multi-axial diagnosis, Axis 1, Bipolar II, Axis 2, none, Axis 3, history of suicide attempts, Axis 4, relationship difficulties, Axis 5, the GAF equals 65. For theoretical perspectives, there is only one, the biological perspective, and that is the client's symptoms may be due to a genetic predisposition. During her depressive period, she may have a deficiency of either serotonin or norepinephrine. During hypomanic periods, she may have an excess of norepinephrine. There also may be an imbalance of serotonin. Brain imaging research has found lower gray matter in the prefrontal cortex in individuals with bipolar disorder, which may explain mood regulation problems seen in bipolar patients. There has also been found shining of the cortex in the frontal and temporal lobes in individuals with bipolar disorders. And that is it for Jessica Scott's story.